Located in Raleigh, North Carolina, is the largest community-based demonstration project ever funded by the Centers for Disease Control and Prevention to respond to the excessive and unnecessary burden of diabetes among African Americans. The project's name is Project Diabetes Intervention, Reaching and Educating Communities Together, better known as Project Direct.
It began in 1996 with interventions. They're research-based, and the research phase of Direct actually ended in 2003. There are three major components to Project Direct: outreach, diabetes care, and health promotion.
We have over 15 years of history with this initiative now. And needless to say, we all know that African Americans are more at risk for certain chronic diseases, and diabetes is one of those terrible concerns that we have. Project Direct has been focused on educating a community to reduce the burden of diabetes.
Project Direct is a community-based, participatory research project that was a partnership between CDC, Wake County Human Services, Department of Human Services, the State Department, and the community of Southeast Raleigh.
To have this kind of a project make an input in a portion of Wake County is very important. Also, whatever the findings are, and whatever the successes are, will rub off on the other municipalities in Wake County.
Project Direct actually has an office, a presence in Southeast Raleigh that most folks, community folks, know about, and they're able to access information, resources, and diabetes education.
Another unique aspect of this project is that it's headquartered within the community in which it serves. Project Direct offices are located in the heart of the predominantly African American community of Southeast Raleigh.
The Southeast Raleigh community is a wonderful place to live. I have lived here since 1962, 45 years. I have found in Southeast Raleigh wonderful institutions. There are the faith institutions. There are the businesses such as the Hamlin Drug Pharmacy, which this year is celebrating 100 years as a continuing operating pharmacy in the state of North Carolina, having the recognition of being the oldest African American pharmacy operating in the state of North Carolina. We have two wonderful historically black colleges, St. Augustine's College and Shaw University. I mention these two because they have provided leadership and community outreach to help us carry out some of the activities that would improve the quality of life in Southeast Raleigh.
The location in Southeast Raleigh was ideal because it was a location that was easy for the community residents to get to. It was a location that was very familiar to persons in the Southeast Raleigh community. And it was a place like home.
Since the project's inception, there have been various activities dedicated to diabetes awareness.
It has had an impact on getting the community and the members of the community more involved in exercise and proper nutrition. In reference to people that have diabetes, it has been a resource. We have a walk-in. You can come into our resource center. We also have diabetes education classes.
Oftentimes the church has been accused of sitting behind the walls, but this opportunity has provided the faith community and the communities that provide services to our disciples to come together and partner and see how needs can be met on both sides, to see how the church members can participate on the task forces and give some of their expertise in the secular field that they have, as well as spiritual discipline.
We work very closely to get them involved with different aspects like church nutrition training and chat where they had a chance to assess their programs and all, and to be evaluated. And of course, this was very helpful because in the past they would mainly just come and eat and not even think about the nutritional value of what they were eating.
We had to actually make churches aware that they may even have people in their churches with diabetes. And you'd be surprised at the number of people that have diabetes that don't know it. So we have gone in, we have done studies, and we've gotten them to actually go and be tested to see if they have diabetes. And then if they do, we teach them how to eat properly, how to eat more nutritiously, how to prepare their foods with less fat.
There have been the diabetes self-management classes, the church nutrition training classes, where staff from Project Direct would go into local churches and they would work with the kitchen committees, and they would teach the kitchen committees how to prepare foods with less fat, because we know that's very significant for persons with diabetes and everybody to eat less fat. Also, they participated in exercise leadership classes, so they would learn how to lead a walking group, how to safely walk, how to do warm-up exercises. We had a number of persons who participated in Direct who became community ambassadors. So they would learn about diabetes, and they would learn about Project Direct, and they would go out in the community and they would share the knowledge about this project and encourage other people to attend.
One of the things a program like this one in particular has done is create new linkages between community organizations. No one organization can do this in isolation. This is an example of a partnership that extends beyond just the local community, because we've got federal, state, county, and community-based organizations working together.
The community is at the table, and they drive the project. When the program was initially started, they determined which interventions we would put in place. They developed the protocols that were used for the program.
The community owns this, and we are partners with them at the table. So it's a different type of environment than what we normally find ourselves in. We are not necessarily the drivers of this boat, the community is. So that's what makes this important, is the community knows what they need, they know what they need from us and what they need from the partnership, and that's what we depend on to make it work.
Project Direct demonstrated that a community that was interested in improving its quality of life could come to the table. They were committed, they remained at the table, they're still at the table, and still had a voice in deciding what should be the role of the community in the research that was going to be done in the community. And I think that is, and just keeping the researchers honest, as they say at CDC, being accountable. And so we are accountable, and we want them to be accountable for what goes on in the community.
Here we had community residents, an advisory council as it was, to sit with the researchers from the beginning to the end, governing every aspect of what was written about the community, what was found in the aftermath of the project, or as we continue to engage with community residents. It's not over, by the way. This is an evolution of the process that we know will continue because of the community participation at every aspect of it.
In late 2006, Project Direct held a forum for the Southeast Raleigh community to share evaluation results from a study on the project conducted by RTI International. It also allowed representatives from the Centers for Disease Control and Prevention and residents of the community to respond to these findings.
The Project Direct study was necessary because we needed to understand both the complexity of diabetes prevention and control at a population level, and we needed to understand how to engage members of the community and what we call enduring community institutions in finding solutions to the problem.
Well, I think it's a very important finding that we learned that there is a way to slow the rise of diabetes in a community like this, because diabetes, as you know, is a terrible disease, and it's a growing problem throughout this country. And this project has found a way to slow that progress, and that's a huge step forward.
The program did reach the community. People were more aware and familiar with diabetes or the complications and issues of diabetes. Also, one of our major interventions was Ready, Set, Walk. And even though people may not be walking or continue to walk as a group, there are more people now walking in the community than were walking, say, 12 years ago.
A number of findings came out from Project Direct. One of the things that we found is that the Southeast Raleigh community, when it was compared to the control group, and remember this is a research study, so there was a control community in Greensboro, North Carolina. At the end of the research in 2003, we found that Southeast Raleigh community residents were more active, more physically active than the control community. We also found that the rate of diabetes did not increase as much in Southeast Raleigh as it did in the control community. And they found that the residents of Southeast Raleigh were more interested in losing weight, in dieting, and learning how.
The main significance is that it showed that the community of Southeast Raleigh had found a way to reach a number of people in a way that worked. They used a very comprehensive approach that tackled the problem of diabetes from many directions. And for those people that Project Direct reached, it seemed to have had a huge impact.
There is a commitment to do good for the community. Now, as you mentioned, there have been people who've been here for even longer than the 5-10. We've been going on since the early 90s. And it's been a time-consuming process, but we want to make sure that not only does it have some impact on the health status of African Americans, but we want to make sure that researchers know this is the way to do research.
I think the impact that we've seen to date is that we've learned some very valuable lessons about what works in the community and what doesn't work in the community in terms of affecting behavior change. That's what this is all about. How do we make our community healthier? How do we recognize the disease that's out there, but also help them either avoid it or deal with it appropriately? And we've learned a lot about what works and what doesn't work through this project.
The project has demonstrated to the community that diabetes can be controlled, that you can be in charge of your disease. One of the things that we found is that participants, persons who have completed our classes, feel more empowered. They feel that the disease is something they can manage, and they learn the proper questions to ask when they see their physicians. So before they might be hesitant to ask certain questions of the physician, when they complete Project Direct's diabetes self-management class, they are much more likely to insist that the physicians give them certain tests at the appropriate times, and that they know what their blood sugar levels are.
The education that Project Direct brought to this community was huge in terms of impact. And the other thing that I've seen here that I haven't seen in many other communities around the country is the sustained involvement. I mean, there are people who were involved 15 years ago who are still around today. But they've also been very effective at bringing in more and more volunteers and expanding the program across the community. So the people who are involved clearly understand their friends and neighbors and how things work in this community. And I think it's a strong, public health lesson that, can be replicated around the country.
For more information about Project Direct, visit our website at www.ncdiabetes.org/Project Direct or call us at 919-856-6540.